Thank you, Madam Chair. I was having a little trouble unmuting there.
I know the feeling.
Also, I want to thank our witnesses also, and just to follow up on the previous discussion for a moment, I feel like when we start talking about care or services related to abortion, we kind of forget that, an innocent unborn child that is created in the image of God is not a disease, a cancer, an HIV/AIDS, a virus, or a substance that's being abused. It's a child. And I just want to put that on the record, because when we're talking about science, I think the science more and more is indicating the importance of recognizing the value of these innocent human lives. I want to begin by asking Ms. Bennett, you'd mentioned your mother, and thank you for sharing your story. And I also, you mentioned that women like your mother would need resources and support as they're going through a challenging time. And you mentioned in your written testimony in the state of Connecticut, housing for young mothers beyond homeless shelters is hard to come by, and lament that St. Agnes Home, a faith-based home for teenage mothers, closed in part because the state stopped referring clients and providing funding. And I can relate to that, because in my home state of Michigan, we've recently seen a similar loss of support for women who have chosen to carry their baby to term. And in 2019, the Michigan Pregnancy and Parenting Support Services Program received $700,000 in the state budget. Funding is a of the state's $58 billion budget. But the legislature and governor were unable to agree on funding, and it was unfortunately vetoed. And without this funding, many pregnancy centers throughout the state will either be forced to reduce their, shut down their. June of 2014, they've served 8,393 clients. 98% of the women were connected to a healthcare provider for prenatal care. 94% took their child to pediatric appointments. 93% kept their child's immunizations updated. And through two local providers alone, Pregnancy Aid and Catholic Charities of Southeast Michigan, over 2,600 women have received support services at no cost to the mothers or their families. And Ms. Bennett, I'm wondering, how do you think the loss of programs like the Michigan Pregnancy and Parenting Support Services Program, as well as St. Agnes Home, affects low-income women?
Well, I believe that it hurts them. And I have personally sat next to women who are in need of housing and called shelters just to hear that they were full, especially in the long winters that we have here in Connecticut. And thankfully, I have been able to turn to a few faith-based organizations like the Nehemiah House and the Malta House, but it's just not enough. And you mentioned the great work of pregnancy resource centers, and I want to let you know and to let everyone know that in Connecticut, they're under attack. The Democratic legislators are literally trying to shut them down by bringing forth false legislation, accusing them of manipulating women and having false advertising. So these pregnancy center leaders have to take time away from helping women to go to the LOB and to defend themselves year after year against these false allegations. So not only do we in our state not have enough support as we need for women that are in crisis and don't have housing, but at the same time, the very people who out of the goodness of their heart are freely offering services to women in need, they have to defend themselves. I've had to go multiple times and speak out and testify and defend pregnancy centers from these lies from pro-abortion radical groups. All the while we're funding abortions. The Catholic Conference says in Connecticut that 75% of the abortions here are funded by Medicaid. It's just wrong. We are punishing and hurting the women who are helping, and we are aiding those that aren't.
Well, and that's a point I